Welcome everyone to the 2 p.m. agenda of the House Committee on Judiciary and Hawaiian Affairs, meeting with the House Committee on Consumer Protection and Commerce. It is Thursday, March 21st, 2024, 2 p.m., conference room 329. We're also having this hearing by video conference. For those who are testifying, I would request that you limit your testimony to 2 minutes. I'll ask you to summarize at that point. And if you're testifying via Zoom, please keep yourself muted and your video off while waiting to testify and after your testimony is complete. If you have any technical issues, use the Zoom chat function to chat with the technical staff only. And if you are disconnected unexpectedly, just rejoin as soon as you can, and I'll try to fit you in so you can provide your testimony when you come back. In the event of a network failure or the power goes off in the building here and we have to reschedule, we'll make sure to post appropriate notice for a hearing or decision making. If you're testifying via Zoom, please do not use any trademarked or copyrighted images because that kicks the live stream off of YouTube, and that will be a problem. And please conduct yourself with aloha and refrain from profanity or uncivil behavior. It's okay to disagree, but let's not be disagreeable. Okay, let's go ahead and get started. We have one measure that's on the 2 p.m. agenda, and that is Senate Bill 2861, Senate Draft 1, relating to exclusive listing agreements. This measure establishes as void and enforceable under state law that governs unfair and deceptive practices certain exclusive listing agreements for the sale of residential real property. It prohibits the recording of exclusive listing agreements of any duration for the sale of residential real estate with the Bureau of Conveyances, establishes that certain exclusive listing agreements shall not be enforceable, have any legal effect, or provide actual or constructive notice, or operate as a lien, encumbrance, or security interest, and it establishes certain remedies. First up, we have testimony from the Attorney General. Welcome. Please proceed.
Good afternoon, chairs, vice chairs, and members of the committees. My name is Tina Tsuchiyama from the Attorney General's office, and we have provided written comments which we believe would strengthen the bill against any potential legal challenges. But I'd like to emphasize our comments are not aimed at the necessity or practicality of the bill. They are just recommendations to strengthen the bill and the off chance there are challenges. I'll be available for any questions. Thank you very much.
Thank you very much. Next, we have testimony from the Department of Land and Natural Resources.
Hello, Chair, Vice Chairs, members of the committee. Les Kobata, the Registrar of the Bureau of Conveyance. On behalf of the LNR, we support this bill. Had original concerns, but are happy with the revisions in SD1. So we're in support now. Thank you.
Thank you.
Available for questions.
Thank you. Next, we have testimony from the Office of Consumer Protection.
Aloha, chairs and members of the committees. Thank you for the opportunity to testify before the joint committees today in strong support of SB 2861 SD1. The measure has gotten some important amendments that addressed concerns raised at the first go-around, at the first hearing. We think this is primed and ready to go. We are take the Attorney General's comments to heart. However, we also think that the notion of a constitutional challenge is fairly theoretical here. In this case, we are intending to target existing contracts precisely because they are problematic to consumers. We believe this is a legitimate public interest, and we want to see that public interest vindicated because these contracts are born out of an abusive bargaining position, and they operate to create liens on the properties where no liens should exist, to create clouds on consumers, on homeowners' title to the property, and divest them of hard-earned equity in the property. We think that this bill should move forward, and we ask for your support and consideration. Thank you.
Thank you very much. Next, we have testimony from the Hawaii Realtors.
Aloha, chairs, vice chairs, and members of the committee. My name is Lindsay Garcia on behalf of Hawaii Realtors. So we do stand in strong support of this bill. We believe it does provide safeguards for consumers It is intended to address a very bad practice that is currently on the mainland, where there was a company who was contracting exclusive right to list for up to 40 years, placing liens on property, and it would follow title. Like, this is definitely a bad practice. We have not seen evidence of it existing in Hawaii. We support OCP and others wanting to preempt this practice entering our state. We do, however, want to point out that we do have right-to-list contracts that do exist that do not have these provisions about lien and title and all of that. And so, therefore, in just these instances where in reasonable contracts that do exist, we're seeking clarity that this measure will allow for situations upon expiration of two consenting parties wanting to possibly extend their agreement, or at the very least not be precluded from signing another one-year agreement in the future. Thank you.
Thank you very much. And next we have testimony from AARP Hawaii.
Good afternoon, Chair, members of the committee. I'm Audrey Suga Nakagawa, Advocacy Director for AARP Hawaii. AARP stands in strong support of this measure. It is, as everyone else has been saying, it is a consumer protection mechanism that we feel is very much needed, and especially for the older homeowners who might be more vulnerable to these type of unfair practices. Just to let you know that I just learned that Oregon was the 20th state that passed a very similar measure. There are 5 other states, which includes Hawaii, that's looking at this. So I hope that we will continue this path and have it pass, and so that will be among the 25 states that has provided this mechanism for their consumers. Thank you.
Thank you very much. That's all that I have on my list of people and organizations that wish to testify. Is there anyone else here in the room or on Zoom that wish to testify on Senate Bill 2861, Senate Draft 1? If not, questions, members. First, the judiciary. Anyone in judiciary with questions? I have a question. May I go ahead? Thank you. I wanted to check in with DCCA. I wanted your opinion. The Attorney General suggested to add a purpose section just to clarify what this is for. Knowing that you do want to look at existing contracts and enforcing using this law if it passes, just adding a purpose section explaining why this is important, it seems like a good idea. Does that make sense to you? Would you support that?
Well, I wouldn't necessarily say a purpose section is, or an expanded purpose section is a necessity in this case. I think we've laid out some findings already in Section 2 of the bill. But I'd be happy to work with the Deputy Attorney Generals and the committees, and I think something that strengthens the bill from constitutional challenge is certainly not unwelcome. It's something we could live with.
The AG had some suggested language in their testimony. Did you read it?
The AG had a paragraph describing what the testimony might look like, and I thought the testimony along those lines would not be a problem.
Okay. Okay, great. Thank you. I wanted to ask, let me ask DCCA if, listening to what the realtors have said, if they have a one-year agreement for exclusive rights to be the representing realtor, and they wanted to renew that or have a new one-year agreement, is there anything in this language that would preclude that?
No.
So we don't need to include any language that expressly approves it because you don't see anything in here that would preclude?
No.
Okay.
And I will say, though, that being the judiciary chair, I know you're aware that parties cannot agree to circumvent the law. So if the parties agreed to have an agreement to renew and renew and renew, our office would certainly take a look at that as a potential unlawful conduct. The type of successive renewals we think are, number one, unnecessary. I just looked up the location's average time from listing to sale. On the island of Oahu, we're looking at 30 days. So why would a listing agreement need to be 1 year, never mind in excess of 1 year, when our housing market is so robust at this point? The demand is so strong.
Thank you very much.
Thank you.
A question for the Hawaii Realtors? Could you explain to the committees why there are such one-year agreements and why there might be an interest of both parties to have a new one-year agreement that would follow subsequent to the expiration of the first one-year agreement?
Thank you, Chair. That's a good question. So we just wanted to be able to account for any kind of situation that could arise. Something could happen, where there could be a seller could decide to delay, wanting to sell right now, so they've already signed an agreement, but they've decided to kind of put that on pause and then come back to wanting to actively list their property later on. They want to continue to retain the realtor that they've been working with. And so there could be situations where it may not be common, but we just wanted to ensure that should two consenting parties agree to want to extend their relationship, that this law would not preclude a consumer from choosing to work with the realtor they want to work with.
Okay. And you heard their interpretation that nothing in the language that's in this bill right now would preclude mutual consenting parties to agree upon another one-year agreement.
If that is the finding of the legislature and of this committee, then we would be comfortable with that.
Okay, great.
Thank you.
Thank you very much. Any other questions from the judiciary side? Let me turn it over to you to see if there are anyone from CPC.
Thank you. Any members from the CPC committee have any questions? Okay, seeing none.
Okay,
Chair.
thank you. Do you have quorum?
Yes.
Okay, we both have quorum, so thank you to all the testifiers for being here. We're going to move directly into decision-making on this measure. My recommendation for Senate Bill 2861, Senate Draft 1, is to pass it out with amendments. I'd like to add a purpose section. We can use some of the language that is in the testimony from the Attorney General. And then in the Standing Committee report, I suggest that we include in there that we have been assured by DCCA that there's nothing in this language here that would preclude parties from mutually agreeing to a subsequent one-year agreement after the expiration of the initial one-year agreement. And also, I want to include in the Standing Committee report the request from the realtors for a start date of November 1st, 2024, to give them time to educate and create new forms. That's my recommendation. Questions or concerns, members? I should add technical amendments just in case, if that's needed. So, questions or concerns, members? Okay, we're going to go ahead and take our vote.
Voting on SB 2861 SD1 HD1. Chair and Vice Chair vote aye. Representative Evslin excused. Representative Ganadin. Aye. Representative Holt. Aye. Representative Ichiyama. Aye. Representative Iligan. Aye. Representative Kong. Aye. Representative Miyake. Aye. Representative Souza. Aye. Recommendations adopted.
Thank you very much.
Thank you, Chair. For the Consumer Protection and Commerce Committee, same bill, the same recommendation. Members, any questions or comments? Okay, Representative Nishi for the vote with amendments.
Okay, on SB 2861 SD1, recommendation is to pass with amendments. Representative Chair Nakashima's excused. Vice Chair Sayama.
Aye.
Representative Amato.
Aye.
Representative Belatti.
Aye.
Representative Hashem. Representative Hussey Burdick, excused. Representative Gates.
Aye.
Representative Loyan, excused. Representative Onishi votes aye. Representative Tam.
Aye.
Representative Perry.
Aye.
Chair, your recommendation is adopted.
There being no further business before this joint committee, we are adjourned.
Good afternoon. I'm calling to order this joint committee between the Consumer Protection and Commerce and Judiciary and Hawaiian Affairs. It is Thursday, March 21st, 2024. It is 2:17. We're in conference room 329. For those who are testifying via Zoom, please keep yourselves muted and your video turned off until it's your turn to testify. There will be a time limit, so please wrap up your testimony when I notify you. First and only item on the agenda is SB 2529 SD1 relating to providers' orders for life-sustaining treatment form. First to testify on this measure, we have Jeanette Koijane from Kukuamau in support.
Aloha chairs and members of the committee. My name is Jeanette Koijane. I'm the executive director of Kukuamau. We are a statewide coalition to improve care for people with serious illness. So I'm a member of the statewide POLST task force and serve on the national POLST as a representative from Hawaii. We serve as the home of POLST in Hawaii, and we worked on this bill because of feedback from our hospice organization. So we stand in strong support to pass the bill as is. POLST has worked well in Hawaii since 2009. It's well used across the state. And we see this technical change as important for helping consumers to have timely access to POLST and coming in line with best practices. So I'm happy to answer any questions, and thank you for your support.
Thank you. Next, we have Rachel Wilkinson from the Hawaii Association of Health Plans in support.
Good afternoon, chairs, vice chairs, members of the committees. Rachel Wilkinson on behalf of the Hawaii Association of Health Plans, and we stand on our written testimony in support. Thank you.
Thank you. Are there any other persons here to testify on this measure? Seeing none, members, we do have written testimony in support from the Hawaii Department of Health, Hawaii State Health Planning and Development Agency, Healthcare Association of Hawaii, Hawaii Care Choices, Aloha Care, HMSA, Kaiser Permanente, and 8 individuals also in support. Members, are there any questions from the CPC committee? Seeing none, Judiciary Chair.
Any questions from members of the Judiciary Committee?
Okay, seeing that we both have quorum, we'll be moving right into decision-making. Voting on SB 2529 relating to provider orders for life-sustaining treatment form. My recommendation is that we defect the date to July 1st, 3000. That is it. Members of CPC, any questions or comments? Seeing none, we'll be taking the vote. Representative Nishi with amendments.
SB 2529 SD1, recommendation is to pass with amendments. Chair Nakashima's excused. Representative Sayama.
Aye.
Representative Amato.
Aye.
Representative Belatti.
Aye.
Representative Hashem. Representative Hassan Burdick is excused. Representative Gates.
Aye.
Representative Lowen's excused. Representative Onishi votes aye. Representative Tam.
Aye.
Representative Perry.
We're voting now. Voting aye.
Chair, your recommendation is adopted.
Thank you, members. Judiciary Chair.
Thank you. On the same measure, I make the same recommendation that we defect the effective date to year 3000 and pass it out with an HD1. Questions or concerns, members? If not, Vice Chair for the vote.
Voting on SB 2529 SD1, HD1, all members being present with the exception of Representative Evslin. Any members voting with reservations or no? Seeing none, your recommendation is adopted.
Thank you very much.
Thank you. This hearing is adjourned. Good afternoon. I'm calling to order the House Committee on Consumer Protection and Commerce. It is Thursday, March 21st, 2024. It is 2:25 now. We're in conference room 329. For those who are testifying via Zoom, please keep yourselves muted and your video turned off until it's your turn to testify. We will be limiting testimony to 2 minutes. I will give you a heads up, and if you could please wrap up your testimony, then I'd appreciate that. First, on today's agenda, we have SB 3239 SD2 HD1 relating to medical debt. First to testify, we have the Office of Wellness and Resilience with comments.
Aloha, Vice Chair, members of the committee, Tia Hartsock, Executive Director, Office of Wellness and Resilience. We're in support of this measure. Although we appreciate the hard work that the Health Committee did, Health and Homelessness Committee did on this, requesting it turn into a working group, and we really appreciate them passing the bill. However, we would love to recommend that this bill is reverted back to the SD1 version, as we've been moving forward in discussions with Queens, and we're happy to engage with discussions with anybody else to really look through the details of the authorization and implementing a program like this without a required working group. Thank you.
Thank you. Next, we have Joshua Wish from Holomua Collaborative in support.
Yes, I will stand on our testimony in strong support. Thanks very much.
Thank you. Are there any other persons here to testify on this measure? Seeing none, members, we do have written testimony in support from the State Health Planning and Development Agency, Healthcare Association of Hawaii, the Queens Health Systems, comments from the American Cancer Society Cancer Action Network, and support from an individual. Members, any questions? Representative Onishi.
For the Office of Wellness,
Aloha.
so in your testimony, it says that it would be counseling $100 in debt for every dollar spent through the program. I didn't quite follow that. So the debt would be the debt to the organization that holds the debt?
So the research that we've done in looking at this, and this is being implemented again in several states right now. In Queens, as was in the last hearing, Queens is actively engaged with this program that does this type of debt cancellation. So it would be medical debt that has gone to collection. So it's already gone through several steps and has gone through collections and is looked at as debt that won't be reconciled by the individuals who are holding the debt. And so what this model looks like is that it will take existing debt that is in collections and buy it back at pennies to the dollar is kind of what the term is, and looking to receive some type of financial increment for the hospital systems. And so it's looking at being able to provide some type of relief to the hospital systems that have had this medical debt with individuals. It's gone through collections. And so it's a way to recoup some costs for the hospitals through an effective financial integration model that this RIP program has been integrating through different states. So there's a calculation that they look at. There's historical information that they look at with the communities that and the demographics that are accruing the debt. There is programs developed that look at educating people and providing financial literacy programs for folks to not incur future debt. So those types of pieces can come in play with this type of a program. So the research and the conversations to continue and see what Queen's experience has been with the RIP program would be something that we would definitely want to engage in.
Okay, so what would be your cost estimate for this program?
I don't have a cost estimate because it looks as, the research has to be done to see how much medical debt is out there, what the demographics are that hold the medical debt. So depending on how other states have implemented it, depending on what our exact medical debt is as an overall state for individuals, we recently just did or engaged in a survey. One of the questions, a statewide survey, one of the questions is, how much do you hold more than $10,000 in medical debt or the threshold of $500 or more? And the respondents so far in our workforce wellness, both state employees and community members, show that there is a number in the population of anywhere between 5 to 12% of the population that has responded thus far hold a medical debt of over $10,000 currently, which in our look at it is a big indicator and factor in social determinants of health that impact later in life health outcomes. And so if you're holding a medical debt that you're not able to repay, it limits people's ability to move further out and create better health outcomes overall. So it informs the way in which people, their mental health is. It informs how the stress impacts of medical debt that they're never going to be able to pay back, especially the ones that are over $10,000. And so looking at this program as it's been implemented in other states has shown quite a bit of success and impacts the folks that are unable to ever pay back that debt.
How long has this program been in other places?
I think, I'm not sure. I'm in other states.
Yeah.
I didn't do that research yet. Like the RIP program, I don't have the timeline. I can get back to you on
I
that.
guess your testimony is you would like us to go back to HD2 or SD2.
Yes,
But the health committee changed it to a working group
correct,
so we could get more details.
correct. We're in conversations right now with Queens. We're engaging in conversations with health systems. We're engaging in conversations with RIP to look at
Yeah,
the details of it.
This is a legislative decision, right? I mean, there's no funding. So how are you going to fund the program?
We're looking at authority at this point. So to do that information dive, but the authority of it, there are private funds that we're looking at. There are other organizations in other states
Okay.
use private funds.
But again, I think that's the justification to the legislature for you to do a study first, bring back the information to the ledge so we can make a decision based on information. Right now, we got no information except that programs exist in other states. We don't know how long they've existed. We know
Queens
that-
has been engaged in it for about 3 years with RIP
Okay,
here.
but they're not here to testify to support it, you know? I mean, they said, you know, in fact, I think they're not against us doing a study. But,
They did
So-
also recommend to go back to the previous SD version in their testimony. But again, happy to have further discussion, happy to collaborate as much as we need to. Working group is a lot of work.
well, it is a lot of work, but it provides hopefully a lot of good information.
Right.
So we can make a good decision. The other issue is we don't even know how much it's going to cost. I do have concerns that depending upon how the debtor is treated after the state buys these debts, it may send the wrong message to our residents that, hey, you know what? Just don't pay your bill, and the state eventually
I can
will
see
take
that
care of it.
concern. Right, I can see that concern.
So that's the information. I would like to see is how that's working in other
Okay.
states.
Happy to provide some further information. They're very willing to have conversations, and they have a lot of that data. I just don't have it on hand. So happy to get that data to you and get back to you on that.
Okay, but that's the whole purpose of the
Okay.
working group. Okay, thank you, Chair.
Okay, members, any further questions? Seeing none, we'll be moving on to the next item on the agenda, HCR 86, HR 72. We'll be taking these two concurrently. First to testify, we have Jeff Zuckernick, individual in support on Zoom. Okay, are there any other persons here to testify on this measure? Seeing none, members, we do have written testimony in support from AED Institute. Seeing that there's no persons to question, we'll be moving on to HCR 119, HR 100. This is urging the Department of Commerce and Consumer Affairs in collaboration with the Department of the Attorney General to investigate and regulate the sale of tickets to live entertainment events under its authority to protect consumers against unfair or deceptive acts or practices in the conduct of any commerce. First to testify, we have Mana Moriarty from DCCA with comments.
Representative Sayama, Representative Onishi, members of the committees, thank you for the opportunity to testify with comments on this measure. I'll just supplement our testimony. We've done some looking into the Carrie Underwood concert pre-sale ticket that's going on right now. The promoter has set aside a Hawaii-specific sale this week. We have yet to receive any public complaints about the process. That is the next big event coming up here in Hawaii. With respect to the Janet Jackson concert series, you have our testimony that we have not received any complaints in this area. But let me maybe just close by saying, I guess the bottom line is, if this resolution is adopted, we will continue to investigate complaints in this area. If this resolution is not adopted, we will continue to investigate complaints in this area. We appreciate the time to the opportunity to testify. Thank you.
Thank you. Are there any other persons here to testify on this measure? Seeing none, members, we have written testimony in support from RISE. Members, any questions? Seeing none, we'll be moving on to HCR 172, requesting the Director of Health to convene a working group to address issues relating to patient transfer and ambulance services and evaluate potential solutions. First to testify, we have Department of Health with comments.
Good afternoon, Chair, Vice Chair Pro Tem, and members of the committee. My name is Lauren Kim. I'm the Planning and Policy Officer for the Department of Health. The department acknowledges these issues affect Hawaii residents, especially on the neighbor islands, but not just the neighbor islands. And we have a commitment from the Director of Health to put this at the top of the agenda for the next Emergency Medical Services Advisory Committee, which is in April. MSAC is a committee of about 40 plus first responders and healthcare providers, fire, Coast Guard, EMTs, ER physicians, hospital systems, that meets regularly to discuss the state of our emergency medical system. And so with that, we have a commitment to take this back and work on this and ask that this resolution be deferred. The main reason being, aside from we have another entity that will be addressing this, is that the title is a bit narrow. It's just not the ambulance portion. It's the continuum of the healthcare service. And we'd like to kind of take as many steps back to see the whole picture rather than focus on just the transport. And that's the commitment of the Director of Health to get this on the next MSAC agenda. So again, we take this very seriously. We want to work on this. This resolution is not necessary, but we will work with the legislature if this vehicle moves. Thank you.
Thank you. Next, we have Elizabeth England from the Hawaii chapter of the American College of Emergency Physicians in support on Zoom.
Yes, hello. Good afternoon, Vice Chair and members of the committee. My name is Beth England. I'm the President-elect of the Hawaii chapter of the American College of Emergency Physicians. We provided written testimony and stand in strong support and are here to answer any questions.
Thank you. Next, we have Melissa Pavlicek from Air Methods in support.
Aloha, Melissa Pavlicek on behalf of Air Methods Corporation. We do support this resolution. The conversation between existing providers does not include people or organizations that might be able to bring some good information and resources from outside of Hawaii or that previously served in Hawaii and due to certain challenges were not able to continue. So we asked for an amendment on the members of the working group. There is a specific incumbent carrier mentioned. I think two of the entities are related, or in fact one entity. So we suggested in our testimony broadening into that, so you might be able to hear from others who are not currently serving the state, but might be able to bring some good knowledge and experience from other places to the table. Thank you.
Thank you. Are there any other persons here to testify on this measure? Seeing none, members, we do have written testimony in support from the Hawaii Medical Association. Members, any questions? Representative Onishi.
Department of Health. Understanding that you have that MSAC, right? How would you folks report back to the legislature in regards to this general issue? I mean, I agree with you. It shouldn't just be ambulances. It should be all types of medical transport services should be addressed.
I think
This bill specifically requires a report back to the legislature.
And the Department of Health is willing to draft a report of findings and recommendations as an unofficial report to the legislature, or not one requested by concurrent resolution, session law, or statute.
Okay, so does this organization currently existing have any statutory requirement to report?
Yes, but it's very specific to the ambulance system and to certain
No,
parts.
I mean, not this statute, but the
Oh,
previous
MSAC's
statute that
enabling-
set up the MSAC? Or was it set up by legislation?
Yes, it's a statutorily authorized committee, and so it is open to the public because it's sunshineable. It posts its agenda pursuant to the Sunshine Law, and the public may attend and others may attend. The department has statutory responsibilities to report, but I need to check if the committee does. If it does, it probably goes through the department, through Emergency Medical Services and Injury Prevention Systems branch.
Okay. And does that committee include all types of medical transport?
Air is there. There's a different committee. There are different committees. There is a specific air ambulance, air transport committee that will also be brought into the picture. And then their findings and their work will bubble up to the committee at large to produce some findings and recommendations.
Okay.
It's a very comprehensive, multidisciplinary, well-attended meeting. It fills our boardroom, and they take their work very seriously.
Okay. Thank you. If I could have a follow-up.
Please go ahead.
Melissa, thank you for being here and your testimony. So, do you think the participation with the Department of Health currently in regards to the transport of patients in the state of Hawaii is addressed through the current committee that's available, or?
What I want to say is the Department of Health leaders have been incredibly open and proactive in reaching out to many sectors and providers, and we have been in conversations with various members of the Department of Health over the last many years, and there are lots of opportunities to contribute information and participate. I'm not very familiar with whether or not Air Methods Corporation has been specifically participating, but taking away from this conversation, I will certainly find ways to participate as a public member and contribute our voice that way, if that's the will of the committee. Yeah.
Okay.
Thank you.
Thank you, Chair.
Thank you, members. Any further questions? Seeing none, we'll be moving on to the last item on the agenda, HCR 173, requesting the Insurance Commissioner to convene a working group to assess the feasibility and impacts of requiring coverage for commercial properties and structures, including greenhouses and shade houses, under the Hawaii Property Insurance Association's plan of operation. First to testify, we have the Insurance Division from DCCA with comments.
Good afternoon, Vice Chair, members of the committee. Gordon Ito testifying on behalf of DCCA Insurance Division. We stand on our written testimony offering comments. I'll be glad to answer any questions. Thank you.
Thank you. Seeing that there's no other persons submitting testimony, any other persons here to testify on this measure? Seeing none, members, any questions? Okay, Representative Onishi.
Yeah, for Mr. Ito, Thanks for being here again.
Sure.
In your testimony, you mentioned mandating coverage of additional risks in certain areas may affect the underlying costs of HPIA. Can you kind of explain that? I didn't quite understand what you meant by increasing underlying costs. Is it to all people covered, or?
So it's in reference to HPIA. Currently, HPIA writes coverage in lava zones 1 and 2, as well as statewide for fire policies. Initially, as you know, HPIA was created back in the early 90s to cover lava risk because the voluntary market pulled out. Since then, I believe it's somewhere probably in 2006 when we had another hard market like what we're experiencing now, where availability was at issue throughout the state or some portions of the state. HPIA expanded its book and offered not only writing coverage in lava zones 1 and 2, but basically statewide. So there are homeowners policies that are written on every island. My comment on this is, should they be, or should HPIA decide to cover commercial risks? Right now, they really don't cover commercial risks. If there's a lot of losses in commercial risks, that would ultimately impact what they're currently writing in terms of the premiums, because the loss might exceed in commercial risk might be a lot more than what they collect in premiums, and that could have a negative impact in the policies that they're writing currently. Or conversely, could be homeowners policy that incurs a lot of loss. So that's really what we're saying.
So this could affect all policyholders?
Yes.
Is HPIA able to specifically offer residential and commercial separate policies?
If the board of directors and the plan of operation does segregate it. To a certain extent, they do that currently, I believe, in the lava zones 1 and 2 versus the statewide risk. That's why in the lava zones 1 and 2, because the reinsurance policy that's covering the lava zones 1 and 2 specifically covers the lava zone areas, which is extremely costly. I think I may have mentioned in the past, prior to the 2018 eruption, the cost of reinsurance to cover the risk in lava zones 1 and 2 was under $1 million. Currently, HPIA probably pays close to $6 million a year on reinsurance costs just for the lava zones 1 and 2, and there's only about 1,000 policies that they write in lava zones 1 and 2. Therefore, the underlying cost just for the reinsurance in lava zones 1 and 2, if you divide $6 million by 1,000 policy, that comes out to $6,000 per policy. And that's why there's, those that are living in lava zones 1 and 2 and buying policies from there, their premiums are extremely high because the reinsurance cost has gone up tremendously. So, but the rest of the statewide, I believe, and I can't speak specifically in terms of how their plan of operation covers the rest of the risks throughout the state. I think there is some segregation in terms of how they're covering the statewide risk on homeowners or fire policies. They're definitely not paying $6,000 per policies in the other areas outside of the lava zones 1 and 2.
Okay, so I have heard that based on the most recent Mauna Loa eruption, that USGS was considering reclassifying portions of Hilo as lava zone 2.
Yeah, I haven't heard that, but I mean, that could be true.
Okay, so if that did happen, what would be the effect? I mean, obviously, there's a lot of residents and there's a lot of commercial property in Hilo. And so if that happens and insurers pull out of Hilo, what would end up being the the potential effect on HPIA?
In the worst case scenario, if USGS reclassifies certain areas of the HELO area, and the voluntary market insurers do start reducing their book and stop writing, then probably, based on what happened when Universal PNC pulled out of the Puna and Ka'u district, they had about 800 or 900 policies, and they started non-renewing back of March of 2023. The alternatives, unfortunately, for those homeowners that were non-renewed, for most of them, they were not able to procure voluntary market insurance. And so the only option they had if they wanted to be insured would really go to HPIA or to go surplus lines to purchase insurance, surplus lines, or in the worst, I won't say worst case, but the other result, if they had a mortgage, they potentially could be forced placed by the lender. So that really was the three things that happened with when Universal PNC pulled out of the marketplace. That, in the very worst case scenario, could happen in any areas on the Big Island that would be reclassified, and if the voluntary market pulls out. If the voluntary market, the admitted carriers stay in the market, then they won't have just an effect of what happened with those in really the Ka'u and Puna district, because their premiums still would be covered under the admitted market.
Okay, so as I look at this list, it talks about commercial property insurance, but the list for people to participate in the working group, right? It talks about commercial property insurance to include greenhouses and shade houses. But the people that are listed as stakeholders basically are the insurance companies or a member of the board of the Hawaii Property Insurance Association, Hawaii Floriculture and Nursery Association, the floriculture business operating in the state, and a representative of the insurer offering commercial property insurance in the state. So it doesn't cover other types of commercial entities.
Not what's on this list right now, yes.
And you're saying HPIA does not currently offer commercial insurance?
Yeah, my understanding is they don't. They offer residential. But within their plan of operation, they are able to offer commercial insurance if the board and the plan of operation allows HPIA to do so. It's within the current statutes that if HPIA chooses to offer commercial or want to write commercial, they could.
Okay.
So short of this.
I'm concerned that this bill only goes halfway, right? I mean, it doesn't look at the total impact of insuring commercial property, not just greenhouses and shade houses.
Yeah, that's correct. I mean, from what I understand on the Big Island, there are issues, or there is an issue rising with respect to availability of commercial insurance, especially in the property insurance, because we receive, I would say, inquiries regarding unavailability to purchase commercial property insurance. I mean, I know there's one some kind of rental, kind of like a small hotel. I believe what that was in the Ka'u district. That business was having difficulty purchasing coverage for their property. And I know that there was another school in the Pahoa area that was having problems procuring property insurance for that school building. I'm not sure if they ultimately were able to purchase commercial property insurance in those cases, because I haven't heard from them since then. This was several months ago. So there is issues not only with respect to greenhouses and the shade cloth availability, But there is the issue about instances where there is difficulty filing commercial insurance coverage.
Yeah, I'm just concerned, so they would keep that area of insurance as a separate area from like residential or other residential areas in the state.
That's the way HPA, the board of directors, as well as the development or revision of the plan of operation, they could keep it separate. Because as an example, in the many discussions that's occurring during this legislative session with respect to condo insurance, right? There's two separate types of policy. There's the on the master policy for the condo building, and also the unit owner building. So how the HPA would cover the condos, for example, if they expand, they could potentially keep it in a separate group, basically.
I'm just concerned that the working group is limited, and you're gonna have a small pool of potential people interested in getting insurance.
Yeah.
Right?
I mean,
Which would
it's
make the costs
it's really
very high.
the legislator's prerogative if you want to expand the scope of the working group.
Well, I
you
mean,
could
we
do.
have all kinds of commercial property, right? In
Yeah.
Alva Zone 2, 1 and 2 areas, so, okay, thank you, Chair.
Thank you. Members, any further questions? Seeing none, we'll be taking a short recess for decision-making. Recess. Good afternoon. Reconvening the House Committee on Consumer Protection and Commerce. This is again Thursday, March 21st, 2024. This is the 2:05 p.m. agenda for decision making. First, we have SB 3239 SD2 HD1 relating to medical debt. We're just going to be passing this measure through as is. Members, any questions or comments? Please go ahead.
I'd like to thank those who testified in favor of it. Generally, coming from a conservative background, I'm more in favor of people being responsible for their own costs, so I'll be voting no, but I appreciate the efforts.
Thank you. Any further comments? Seeing none, Representative Onishi for the vote as is.
Okay, SB 3239, SD2, HD1. Recommendation is to pass unamended. Chair Nakashima is excused. Vice Chair Sayama.
Aye.
Representative Amato.
Aye.
Representative Belatti excused. Representative Hashem.
Aye.
Representative Hussey Burdick excused. Representative Gates.
Aye.
Representative Lowen excused. I vote aye. Representative Tam is excused. Chair, your recommendation is adopted.
Thank you. Next, we are moving to HCR 86, HR 72. This is encouraging private businesses with 30 or more employees to have an automated external defibrillator on site. Recommendation is to pass as is. Members, any questions or comments? Seeing none, Representative Onishi for the vote as is.
HCR 86, recommendation is to pass as is. Oh, and 72.
Yeah. Yeah.
HCR 86 and HR 72, recommendation is to pass unamended, noting the absence of Chair Nakashima, Representative Belatti, Representative Hussey Burdick, Representative Lowen, and Representative Tam. Any members voting with reservations? Any members voting no? No. Okay. Representative Perrick, no. Okay. Vice Chair, your recommendation is adopted.
Thank you, members. Next, HCR 119, HR 100 will be deferring this measure as DCCA's testimony noted. They'll be doing this either way, so we urge them to continue doing their work. Next, we have HCR 172 requesting the Director of the Health to convene a working group to address issues relating to patient transfer and ambulance services and evaluate potential solutions. Recommendation of this measure is to pass as is. Members, any questions or comments? Seeing none, Representative Onishi for the vote as is.
Okay, HCR 172,
No, it just says
oh,
HCR.
just,
Yeah.
okay, sorry. Let's see, noting the absence of, excused absence of Chair Nakashima, Representative Belatti, Representative Hussey Burdick, Representative Lowen, and Representative Tam will be excused for the rest of the agenda. Any members voting with reservations? Any members voting no? Okay, Chair, your recommendation is adopted.
Thank you. Finally, moving on to HCR 173, requesting the Insurance Commissioner to convene a working group to assess the feasibility and impact of requiring coverage for commercial properties and structures, including greenhouses and shaded houses under the Hawaii Property Insurance Association's plan of operation. A recommendation is to pass this measure out as is. Just want to note in the committee report, this is a work in progress, and I think further clarification on the scope and intent of the resolution would be helpful as well. Okay, members, any questions or comments? Seeing none, Representative Onishi for the vote as is.
Okay, any members voting, oh, I'm sorry, HCR 173, recommendation is pass as is. Any members voting with reservation? Any members voting no? Chair, your recommendation is adopted.
Thank you, members. This committee is adjourned.